वेलकम बैक व्यूअर्स ऑन हेल्थ मैटर्स। हम बात कर रहे थे डॉक्टर हुसैन के साथ ऑन डायबिटीज़ और हम ब्रेक से पहले हम बात कर रहे थे इंसुलिन के बारे, तो आए जाने और Yes, doctor. We were talking about insulin. Tell us, while taking insulin, does medication and insulin affect each other, or is there a harm to the body?
Actually, we are not giving everyone insulin. Again, type 1 diabetes, we are giving insulin.
Yes.
Medication does not work. Type 2 diabetes, we are giving medication. First of all, prevention. We
Yes.
try to prevent
Yes.
exercise, diet, and all other instructions we are giving to the patients to reduce the sugar level. If does not work, then we are giving the pills.
Yes.
If that also does not work, we are adding another pills, another one.
Yes.
If that does not work, then we are giving insulin with the pills. Sometimes medication has a lot of side effects. If you have a kidney problem, we cannot give you metformin.
Yes.
We cannot give you other medications. Then we have no choice. We are going to give the insulin. But there is less side effect interactions with the insulin.
Yes. Dr. Hossain, we were talking about diabetes, and you were saying that the symptoms a patient can feel is they might feel thirsty or a little dizzy or palpitation. That's those signs. Is there any changes in the body that they should be aware of?
Of course, yes. So they all, of course, if diabetes, they go to the bathroom more often.
Yes.
They can tell, oh, I'm going more often now.
Yes.
I'm losing weight.
Yes.
They can tell. They can talk to the parents, they can talk to the friends. You know, I was 110, now I am 100.
Yes.
And also they can say, oh, I'm not seeing well. It's blurry. My eyes are blurry.
Yes.
You know, so these are the symptoms. I mean, signs you can see. When you
Yes.
go, you can examine the patients.
Yes.
You can find some.
Yes.
But we, when it is serious, basically long term, not taking any medication, not following any doctors, then it affects the kidney, heart, and stroke, and the food
Yes.
also. It affects.
So a person with diabetes, either they gain weight or they lose weight. That should be awareness as well.
Of course, yes. And basically losing weight with hyperglycemia.
Yes.
They're losing.
Yeah. What are the most common complications a patient has with diabetes?
Okay, diabetic patients basically affecting the eyes.
Dies. Okay.
And most important thing, we have to check the food also. And it causes neuropathy, like decrease the sensation,
Yes.
decrease the circulations, blood supply to the lower extremities. So the patient will tell you, oh, I'm not feeling anything lower, my legs are getting cold.
Yes.
And also the eyes, of course, and dental also you have to check,
Yes.
annually. They affect, those are diabetes, then we have to follow those other things.
Yeah. You were saying that they might feel pain in their lower legs, or they don't feel any sensation or dental problem. So all this should be considered awareness for diabetes.
Diabetes, these are the complications of the diabetes.
Yeah. So once they find out that these are the complications, they have to treat each and everything, or once they start exercising, taking medication, it will be
Actually,
okay?
these are the complications of diabetes until these are the mild,
Yes.
and we have to control the diabetes first.
Yes.
Most of the time, if you control the diabetes, other symptoms will be resolved.
Yes.
So we have to take care of the diabetes, number one. Then we have to follow with the eye doctors, kidney doctors,
Yes.
and cardiologists to check in the heart.
Yes.
Then podiatry to check the food. We have to follow recommendations accordingly.
Yes.
But first we have to control the diabetes. Then at the same time we have to refer the patients for the follow-ups.
Yes. Dr. Hossain, you know like how our Pakistani, Indians, and Bangladesh people love to eat sweet, such as rasgullas and malai.
Yeah, rasgulla
yes,
and
and
misti
barfi and all the
barfi,
sweet stuff.
yeah.
Why is it that they get so attracted to the sweet, knowing that they're not supposed to have it, but yet they do have it?
Actually, I see also same thing. I have a friend also, the Pakistani. I used to go his house,
Yes.
and we studied together. When I go there, he bring a lot of sweets,
Yes.
rasgulla especially.
Yes.
And actually they grow up like our community, the Bengalis, Indian and Pakistani community. You eat, you take for lunch roti, right? Roti.
Yes,
We
roti.
eat the rice.
Yes.
So this is basically we grow up. You grow up that way. But I'm not saying you cannot eat or cannot take sweets.
Yes.
You can have, but you have to reduce the number of rasgulla.
Yes.
You have to reduce the amount of rice.
Yes.
So then we have to control. We need, even though if you have diabetes, it does not mean you have to stop eating.
Yes.
You need energy, you have to survive, but you have to be limit.
Yeah.
No?
So, doctor, is that a psychology thing that they feel like eating sweets, or they just want to eat sweets?
It's like, same they grow up, that they think is nothing, this is part of our diet, meals.
Yes.
So they take it, but if, like smoking, if you ask someone to stop smoking, it's very
They won't,
hard,
yes.
very hard. Same thing sweets, if you ask them, they are not going to stop.
Yes.
But we have to counsel.
Yes.
That you have diabetes, you have high blood pressure, high cholesterol, so you have to reduce the number of rasgulla and you have to reduce the number of rice in the meals, so at least, and explain them about the complications of the disease, then they might know and they can follow you.
Yeah. Yes, Dr. Hossain, I have noticed that some of our Pakistani, Indian, and Bangladesh community people, they would eat more sweets, but they would have no sugar in their chai, in their tea. Is that okay? Should they reduce the sugar in the tea, or they should add the honey or the Splenda, which is a chemical? Would you suggest that?
Honey actually also the sugar.
Yes.
There is a sugar, and they can have some sugar-free items, but
Okay.
make sure there is less fat or carbohydrate.
Yes.
Because you making rasgulla with the flour,
Yes.
you're giving the items, there are some fats, some carbohydrates, that also converting to sugar.
Yes.
Even though you avoiding sugar-free, you're saying that I'm taking sugar-free.
Yes.
But I'm not suggesting the sugar-free Splenda all the time, but you can have some, but not always. This is also chemicals.
Yes.
This is harm for the body also.
Yes. So does the Splenda, which is made out of chemicals, it's artificial,
Artificial.
correct?
Yeah.
So how does that affect on blood sugar?
No, that does not
That
affect.
does not affect,
Not
okay.
affecting. That means there is no sugar there.
Okay.
This saccharin, this is another form. So that does not increase the sugar.
So that does not increase the blood sugar at all.
No glucose.
But that does affect the body.
Long term, if you use, but there is another study, but I have no clue on that.
Okay.
But I'm not suggesting to take that long term. You can have some,
Okay.
for the teas, 1/2, and it's little bit is okay.
Yes.
But you take for everything all together, for the rasgulla one, for the tea one, for
Yes.
others, payesh or a lot of things
Yes.
you're making, that is harm for the body, I believe that, because there's chemicals,
Yes. Yes, Dr. Hossain, tell me about high blood pressure and low blood pressure with a diabetic person. Does their blood pressure affects having diabetes?
Yeah, that is another very important thing. JNC7, that is American Medical Association, also they have recommendations. They said those who are diabetic,
Yes.
their systolic, there are two types of blood pressure. One is systolic blood pressure, one is diastolic blood pressure.
Yes.
Their systolic blood pressure should be lower than 130, and diastolic blood pressure should be lower than the 80. So we always have to follow that rules.
Yes.
Those who have diabetes, blood pressure should be less than 130 over 80.
Yes. Doctor, I just remembered a question. We were just talking about the rasgullas and the sweets about for diabetic people. What are some good food that our diabetic patients can take and feel good with it?
Yeah, that is important. The flour.
Yes.
You go to the Pakistani restaurant, Pakistani house.
Yes.
They are making flour, roti.
Yes.
So I'm advising them to avoid flour. Those who are diabetic,
Yes.
those who are obese and non-diabetic, also for them
Yes.
too. you can get the wheat, the wheat.
Yes.
It's called atta something.
Yes.
In atta, right?
Atta, yes.
Atta. So you can have some atta to make the roti.
Yes.
Avoid flour. So you having less carbohydrate.
Yes.
And also you can add fruits in your meal. You can like corn, the vegetables,
Yes.
salad,
Yes.
the items. And you can get the fish like tuna fish, you can
Yes.
get salmon fish.
Yes.
And the meat is most important thing that we have to lower down,
Yes.
because these are the most, if you want to have some beef, sometimes you want to have some,
Yes.
but make it a small slice, very little, tiny slice, then you can burn out the fat.
Okay.
So if you cook, the fat is gone. So make it small, then in that way also you can get less fat from the beef. And I have one suggestion also for the patients.
Sure.
If I already mentioned before, they should take their dinner at least 3 to 4 hours earlier before going to bed. In that way, they can reduce diabetes, they can prevent diabetes, high blood pressure, high cholesterol, and like serious conditions like myocardial infarction and stroke. So in that way, we can prevent very serious disease kind of things.
Okay. Doctor, now it's the time for a short break. नाज़रीन, हम जल्द हाजिर होंगे एक छोटे से ब्रेक के बाद और हम और जानेंगे डायबिटिक्स के ऊपर.